If you struggle with fibromyalgia, you probably experience the chronic, often debilitating pain, along with the other issues that come with it, like sleep problems, fatigue, and even memory issues. You've probably been to a doctor who's told you that it's all in your head, that you're crazy, and maybe a doctor has even told you that you're lying to them and you're just trying to con them to get medications. If this is you, watch till the end of this video because I'm going to share with you how chronic pain syndromes like fibromyalgia are real and what are some of the problems that cause them and what are the solutions that can be done about them. Hey, I'm Dr. Sam McDonald. I'm a brain health expert and this channel is dedicated to helping you rewire your brain so that you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. Fibromyalgia is a connective tissue disorder that is characterized by pain in multiple places in the body, often accompanied by fatigue, memory issues, sleep disturbances, and anxious or depressed mood states. When women are more than 9 times likely to get fibromyalgia than men, and there are 3 unequal causes or contributors to fibromyalgia. I say unequal because it's kind of like a recipe. There can be different causality factors in each person that struggles with fibromyalgia, some having a greater impact than others when it comes to this particular condition. Now those 3 contributors are viral infections, physical trauma, and emotional trauma. So when it comes to viral infections, there are really 3 underlying viruses that can lead or contribute to somebody struggling with fibromyalgia, and that can be the rotavirus, herpes, and the most common by far, number 1, is the Epstein-Barr virus. Now, treating these viruses and taking care of them and getting them back into a normal baseline healthy state where they're not causing problems in the entire body can often help with some of the underlying conditions and issues here. But understand, when you're treating the viral infections, you're still treating a downstream problem of really what's going on. These are usually caused by an overexhausted immune system, which is the result of an overexhausted nervous system. So make sure that you're actually taking care of both of these things at the same time. Some other contributing factors that can be causing these increased viral loads can be increases in heavy metal toxicities, underlying gut pathologies like SIBO or other yeast infections. Those kind of things can also cause an increase in viral loads. But understand, these are going to be downstream problems to other what are called neurological impacts. The second cause or contributor to fibromyalgia is physical trauma, and specifically this is head trauma. The most common cause of this can be car accidents, specifically those whiplash injuries that causes the head to rock forward and backward. This can cause damage to a couple different areas in the cervical spine. That's going to be with the mid-neck and up at the top of the neck where the skull meets the neck at the atlas and occipital junction. These can be contributing factors because of how much what's called proprioceptive information is fed up into the brain. So proprioceptive information is sort of like the food for the brain. It's the brain-body connection. And proprioception is where your body's at in space. So if you have damaged or altered proprioception, what this can start to do is change this sensory integrative state from the body to the brain, thus driving the brain more into a chronic fight or flight state, which is going to cause the brain now to get more disconnected from the body. Fibromyalgia could be likened to an adult syndrome of sensory processing disorder. However, it's a bit different with the pain that is being presented or the pain that's present in the body. So physical trauma, like I said, car accidents. It can also be from other concussive blows, potentially from a fight, a slip and fall on like ice or around water, any kind of things that can cause physical trauma to the brain, because that's going to alter the brain's processing and proprioception or connection to the body. A contributing factor to fibromyalgia is emotional trauma. Some would argue that this is actually the biggest contributor to it. I would tend to agree because of the prevalence of unresolved emotional trauma that we see in the majority of our clients and the majority of the public. Now, when it comes to emotional trauma or emotional concussion, you can really classify these in 2 different ways. You have your major traumatic events and your low-level chronic minor ones. Both of these are going to lead you to the same place depending upon your adaptability and resiliency levels. But your major emotional traumatic events are going to be things like the death of a loved one, divorce, and even the unwelcome sexual events like rape or molestation can all be contributing factors to these things. The minor traumatic events can be those low-level minor anxious events, or the what we call low level stress events. This is the things that wear you down day in and day out as you're not taking care of yourself, taking care of your resiliency and adaptability levels. So, the things like your work, finances, traffic, all those sorts of things that keep your nervous system in this higher tuned state that over time start to wear the body down. Once it hits that tipping point, now it's no longer able to properly adapt to the stress and demands that are put on it. Thus, the body accelerates in its breakdown, ultimately leading to the brain not able to properly regulate. Thus, fibromyalgia symptoms start to appear. So what this looks like in the brain when we start to look at it is we start to see differences in two functional areas of the brain. We look at the back of the brain, specifically looking at the ratios between fast and slow wave frequencies. And most commonly what we'll see with clients with fibromyalgia is going to be an elevation of fast wave frequencies in the back of the brain. This is going to lead to those problems of sleep disturbances, inability to quiet the brain down, thus those anxious mood states, as well as some of the foggy thinking because the brain's not able to properly calm down at nighttime, not able to calm down during the day, and it's not able to quiet the mind down. That's going to lead you to this feeling of just never being able to have quiet or peace in your head. Now, we'll often see the flip of that in the front of the brain where we have too much slow wave frequency, which is going to lead to that what they call fibro fog or that brain fog sensation, as well as that inability to focus and concentrate, and the memory issues because the brain's not able to properly catalog information. So we see a flip there where too much fast in the back and too much slow wave frequency in the front. We'll often also see sometimes some balance and coordination issues with these as well, but the major contributors is going to be really how well and how fast or slow the brain is functioning. Because remember, at nighttime when you're going into those sleep states, you want to be able to wind or slow the brain down, thus getting into those deeper sleep states of healing and rejuvenation and energy creation. And then during the daytime, the brain needs to be able to wind up to be able to focus and meet the demands of the day. So remember, your brain has to be plastic, has to be mobile, has to be moving so that you're constantly receiving and moving information where it needs to go, and thus also being able to quiet down some of the information coming from the body, thus quieting down those pain signals. So on that note, you should be healthy by choice, not by chance, and for that reason, I will see you on the next video.